Welcome back to Good Day at 9 a.m. We are all about your heart health this morning. We have been spending time here at Virginia Heart in Falls Church, and we've been talking about a lot of different things. If you were with us last hour, you saw that I actually did a stress test. Well, guess what? The results are in. Maybe this is the most stressful part. Dr. Levy is going to tell me how I did.
You did great. You're in great shape.
Now, you're not just saying that because we're on TV.
No. You did 15 METs of exercise. That's metabolic equivalence. That puts you in the top, like, 5% of people your age in terms of conditioning. And looking at your tracings here, you did great. You got your heart rate up to where it needed to be. There were no changes on here that would indicate that there are any significant blockages in the arteries to your heart that are preventing an adequate blood supply. You had a normal heart rate and a normal blood pressure response. But you still need to check your blood pressure.
I'm still going to do it.
Right.
I'm still going to do it.
Right.
But one of the reasons we came here is because, you know, we've talked a lot about it. Allison had her scare, and she's reticent to do the stress test. But also the fact that heart disease in women is often just overlooked.
More women die from heart disease every year than men. And I've asked Dr. Paula Pinell-Salles, one of my partners, to come over and talk about women's heart health issues with us today, because women somehow think they're immune from heart disease. They're not.
And you know, this is not just for TV either. Literally, you just came from the ER, and what happened?
So I literally just came from the FACC ER, where I took care of a 49-year-old woman presenting with her first heart attack.
Really?
So, yes, and kind of like the classic teaching, she presented with atypical symptoms. So not the crushing elephant on the chest pain that we think of classically with a heart attack, but vaguer tightening across her shoulders, upper back, and arms. But she was smart. She chewed 2 aspirin, dialed 911, and got in via ambulance to the emergency room, which is what everyone needs to do when you have these ongoing symptoms and need to be evaluated.
So that's my question I wanted to have, because we've heard a lot about the fact that the symptoms are different between men and women. So what do the different genders need to know?
Well, so chest pain is still the most common symptom. It's just often milder or more atypical, kind of as I described, maybe in a different location and milder. And it may not be the most prominent symptom. So they may just be more short of breath or profoundly fatigued or lightheaded. And these vaguer symptoms can go missed, right? Because we're both under-recognizing our risk and because the symptoms are vaguer. So if you delay your presentation, that can impact how you're going to do long term. So it's very important to recognize early and get in.
Well, we've been talking about 2 different tests specifically here this morning. Dr. Levy, I want you to come back in before we wrap up, because the stress test is not something you can just go ask to have done. Because I did have someone hit me up on Twitter and say, hey, I've never had this done. Should I ask my doctor if I should have it done? That's not the case.
No, it's exercise testing, whether it's a plain vanilla treadmill or something more sophisticated, has certain indications based on the clinical presentation. When we talked about coronary artery calcium scoring, that's something anyone can do, but again, it's not really valid until men are 45 and women are 55 years old. Younger age groups, it's not a 0 score, isn't going to have that same predictive value that we talked about earlier in the morning. A 0 score really puts you in a low risk group. But
so just to reaffirm, in case there's somebody out here that fits this category, it's a woman who is not yet 55 and she has been ordered a stress test. She can't just go do the calcium scoring.
Right, Allison can't just do, no, she could, but we talked about that. She, you know, follow your doctor's recommendations. You know, these recommendations are based not just on one piece of data. It's a lot of data, your risk factors, your labs, your blood pressure. Again, know your numbers, but
thank you.
Yeah.
We got to go this morning, but listen, we're Team Allison, and we're Team Heart Health for everybody that's out there. Hope somebody learned something this morning. Back to you guys.
Holly, I was all ears. Very informative. Thank you for that, and thank the doctors as well, because, goodness, they really have us thinking this morning and wanting to make changes. So thank